With a population of about 260,000 people and still growing, Namayingo district survives on a health center 4. Buinja Health Center is the only referral hospital. With high incidence of malaria and typhoid across the district, the hospital survives on one doctor, assisted by few qualified nurses amidst limited medical equipment. Tony Wambaire is the health inspector of Namayingo district.
And even the equipments in the health center are still very few. We may have more than 1 or 2 patients, and yet the equipments like the beds and so on are not enough.
The highest medical unit in the district has no ambulance. The structures are in a sorry state. No running water. It is unhygienic, it is congested, and local administration appears to be stranded. They can't do much but to survive within the situation they are in.
We have little to do since our resource envelope is quite limited to enable us procure an additional van to support the number of patients we are recording day by day.
Patients are reported to be ferried on motorcycles in case of an emergency. The government pickup that was sent here to serve as an ambulance is down. The area member of parliament also donated an ambulance that never lasted as a result of being overstrained. The demand for transport means for patients is high, but there is no way out.
What pushed me to do that, the rate of death was high. Actually, we were burying like 10, 8, 5 people daily. When I bought that ambulance, the rate lowered to 2 or even 0. And that one, the one I bought, was overwhelmed with the work, too much work. It was working 24 hours. And I've seen as an individual, it is a bit tricky to handle such a load.
Built in 1960 as a dispensary, it was elevated into Health Center 4, though medical practitioners term it as a Health Center 3, according to what it has in terms of medical facilities and personnel that only includes 20 beds. Buiga Health Center 4 is now a referral hospital that serves over 260,000 residents of Namayingo. And at night, 10 p.m., we decide to go back and find out how patients are attended to. We seek company from district leaders led by the resident district commissioner, Samuel Mpimbaza Hashaka. Inside this referral hospital, women are sharing words with men. There is only one medical personnel on duty, a nursing assistant, a post that was scrapped off from the medical profession in Uganda. He has no medical training, but is treating patients. He is administering drugs. He is the doctor in charge. No nurse is present. He does not have enough light. He is operating in darkness. His mobile phone is his source of light in measuring medicine and injecting. He is in charge of 3 wards: children ward, mixed adult ward, and maternity.
Okay, me, I'm a nursing assistant, volunteering. I'm Munyakol Enoch.
How are you volunteering?
Me. So because now it is through the animal give us PhD fund.
How much are you paid? You can tell them.
Okay, the amount. I don't know the amount, but they normally give us some little money.
How much?
Like 50,000
For how long?
for a month.
Yes, he operates on experience he gained after seeing nurses and doctors working some years back. But because he is the only one on duty to offer that much needed health service, no action can be taken against him. After all, he is saving lives. In fact, the RDC and his mayor had to thank him. Nurses don't reside in the district. They leave duty as early as 5 p.m., leaving their job to this unqualified nursing assistant that earns a paltry 50,000 Uganda shillings as his monthly salary.
That title of nursing assistant was phased out. It's no longer there. A nursing assistant used to be those ones who help. He's supposed to be helping like a nurse or a doctor to bring drugs and so on. But now we are seeing a volunteer is the one in charge of the situation. He's working like a doctor. He's giving the prescription. When I came this evening, I found he was even in the theater operating somebody. They call it suturing, you know. He was even, you know, stitching somebody, which is very, very dangerous.
As the unqualified nursing assistants attend to a border accident victim, a woman is in labor as a child in critical condition requires an anti-malaria medication. How he is going to attend to them all is not clear, but is also impossible. Kenneth Bugiri, WBS in Namayingo district.
Yes, that's what I'm saying.